Healings take times. I'm Dr. Clement Ng. So why this particular topic for discussion in this current seasonal updates? Forward. Questions such as how soon will I recover? Why is this taking so long? Are increasingly common in clinical practice. A patient come to see me after a week. How come not cured yet? How come I still having this problem? How come I still having not recovered yet? I always highlight a very important statement in Chinese. 兵败如山倒，病气如抽丝. When illness occur, it come in a sense, whole thing, lock, stock, and barrel come unto you. You take 5 years to build a building. You take 1 second to collapse the building. You take another 5 years plus maybe 1 more day to build the buildings. So it's very important for us to understand healing takes time and often misunderstood. Healing is time dependent, biological and physiological process. All our bodies, different tissues heals at different speeds. And it also coincide with the important aspect, how old are you? Before 40 years old, you don't do anything, tomorrow you can be better you than you today. But after 40 years old, you're going downhill. Tomorrow if you don't do anything, you're definitely getting worse off. We are aging. Sometimes a Chinese statement, 我派就是后, it can be a better statement than when can I be cured. So this symptoms, relief, and complete healing are not the same. So there are issues in our body, they are in different part of the body. For example, in area like rapid turnover tissue, days to weeks. Your skin, you have a cut, you have a problem, within 5 to 14 days, it can show results. For example, one of the diagram that I shows in my fundamental class, maybe I show to all of you here. This is a patient of mine where she has a skin problem. So this is where you can see, first day when she see me, it's like this. 1 week later, 7 days later, improve. 14 days later, we can shake hands. So this is where the condition is at a skin level. The recovery can be fast. So 5 to 14 days. If a digestive system condition, mucus, 3 to 5 days. If a corneal surface, 24 to 72 hours. Condition happen around the blood vessel lining. It may take 1 to 2 weeks. I will giving you a write-up of all this after the class. It's a very comprehensive writing that I have prepared. So for those operating in the moderate speed tissue, take weeks to months. For example, you have a muscle weakness. Your muscle is damaged or muscle is weakness. You have pain. For those remember, I mentioned before, last 2 weeks, my leg, I cannot stand up properly. Why? The weather was cold. I'm yang deficiency. It takes me weeks to recover, to months. You have a muscle damage, it takes up to 6 months. You have tendon conditions, it takes 3 to 12 months, it takes years. You have a ligament tear, 6 to 12 months. You have a bone conditions, it can be 6 months to 18 months. 伤筋动骨, we call it, it's a few hundred days. So idea is like that, you have to have this expectation in place. And I hope all my students or participants understand this. When you go for a treatment, be mindful of the question that they ask. And the practitioner tell you 10 sessions. It's just aggregations, just to meet your expectations. And the lung may take 4 to 8 weeks or even longer, depending on how bad the condition is. That's the reason why for long COVID, some can be a lifetime. Then you talk about the other slow healing system. They take months to years. A nerve take months to years. It grows a millimeter a day. A millimeter a day. So you have a nerve conditions. sometimes it takes very long. Brain condition, neuroplastic-based recovery, depending on how the treatment has been done. You have a cartilage, often incomplete, and you have a heart muscle condition, kidney problem is a long-term adaptations. And when it comes to phases of healings, there's always a period alignment in the sense, acute phase. Then we go to the repair phase, remodeling phase, and functional adaptations. So question is, for example, when it comes to treatments, for stroke and stroke sequel management, I have a class on this. The first 6 months is very important for the patients to be able to cooperate with the health and wellness practitioners. Besides TCM practitioners, your physiotherapists, your doctors, your occupational therapists, speech therapists. The engagement with them will allow you to improve your chance of recovery. And this repairing process takes time. And for a couple going for fertility treatments, how soon can you see a result? It takes 6 months because the sperm from gestation to maturity, it takes 3 months. The eggs took 5 months to maturity. So whatever you're doing for the first 2-3 months is always prior treatments. So if you start a treatment today, the real result of the current treatment can only be seen 5 months down the road. So if you are those who cannot wait, you expect instant gratification. Everything takes time. Because pain may improve earlier, but healing continues silently. And from a TCM perspective, this approach itself also look into the field approach. Restoration of the qi, energy flow within the body, the fundamental substances within the body, the blood, the essence, and the so-called the shen, overall arcing representation of individuals. So this require time and consistency. So remember, healing is not slow. Healing is sequential. Everything, every day, something happens. So there's always a statement, a lucky practitioner treat you last. An unlucky practitioner treat you first. For example, I share with you, pregnancy take 5 months. Minimum 5 to 6 months. So you approach a practitioner or approach a doctor, gynae whatsoever, for help in your fertility treatments. After 1 month, you give up. Another one. After 1 month, you give up. By the time you fifth change until the 4th one, and now it happened. Wow, this one very good. Question is, whose effort? It's actually the first one, no? But nevertheless, everything takes time. So remember, time is an essential therapeutic element. So this is the one extra thing I want to highlight here. It's a full report, but I want to take a few minutes to share here with all of you.